issues in mHealth. And I'm delighted to introduce Tim Andrews from ORCA. So Tim is an entrepreneur and a co-founder of ORCA and a lawyer by background, so he's obviously a good guy. And Tim specializes in technology and commercial law and became an expert in the emerging .com and e-commerce environment. He's very experienced in the health sector, and he has supported the development and delivery of digital health assessment and accreditation models and approaches for a wide variety of pan-national, national, regional bodies, and is a recognized authority on these approaches. Tim, welcome.
Thank you, Bladin, and welcome everybody. I'm just going to share my screen. And hopefully you can all see that. And we'll check this bit. Yes, well, thank you, and it's a pleasure to be with you all here today. And yes, well, it's a wonderful introduction. What I was hoping to do, normally when I do sessions like this, I kind of describe a lot of the problems associated with digital health assessment, and today I thought I'd try and focus a little bit more on the solutions and really describe a lot about how ORCA have gone about sort of solving some of these challenges, and how that's been applied to lots of different national schemes, as Bledin alludes to. So, but first of all, ORCA are probably most recognised as being the leading digital health assessment provider in the world, but our mission actually is not to assess digital health products. It's actually to get more people using great digital health solutions. And for us, ultimately, that actually means to achieve that, we need to support healthcare and health and care systems to adopt and use digital health as part of their day-to-day mainstream kind of way of working. And so a lot of what we do is focused on that. Now, there are lots of barriers, of course, and many of you will have come across many of these aspects. So trust and safety I'm not going to go into now because that's the main focus of what we're going to look at. But in addition to that key issue, there's also things like awareness and habit, with digital health not yet really being an habitual part of most people's day-to-day, most healthcare professionals' day-to-day working life. And the systems and processes don't tend to exist to support the that systematic use of digital health in the same way that you would expect for other therapeutic areas. And then, of course, linked to that is governance and risk. How do these solutions actually start to work within the governance framework of a healthcare system? And finally, return on investment. What's the business case? And actually that area is still an area where there is a significant lack of enough information really to help people make informed decisions.
Tim, can you put the slides into presentation mode? You're showing they're not on full screen. Yeah, please.
Oh, do apologise. Why can't I do that?
Is it use the slide?
Do that.
Yeah, down at the bottom. Yeah.
Apologies. So what that basically, another way of looking at those two challenges is to think about them as 5 steps to improving digital health adoption and integration. And so those steps, typically for us include the assessment and accreditation step, which I'll come back to in a second. Promotion and dissemination. So assessment is for a purpose, and that's to get the right products to the right people. Professional activation, that's all about building those key environments and tools that allow professionals to properly engage with digital health. And part of that is pathway integration, actually embedding these tools into key pathways. And then finally, solving the financing and prescribing side of the equation to make the whole system sustainable. But of course, it all starts with trust. And with over 365,000 products out there, how do you know which products are going to be safe and effective? Now, this was where ORCA started when our journey to deliver that mission really was founded on that trust issue. and how to overcome that. And once we started looking at that, we realised actually there were some very unique challenges in the world of assessment for the digital health posed. So one obvious one was simply the scale of and the number of products available. When we started, there were 100,000 products. There's now over 300,000 products. And of course, they're constantly changing. Agile development nature of this environment means that products are continuously updating, and those updates aren't usually minor. They can sometimes be considerable and change fundamentally the nature of the product. So how do you keep on top of that from an assessment and an accreditation type perspective? The risks and liabilities associated with the digital health are still relatively unknown and emerging. So that can place that means that people are not sure exactly what they're trying to resolve in an accreditation process. The range of assessment disciplines or domains is vast, and we'll come back to that in a minute. And of course, regulatory and technology change is constant, and we've seen just in ORCA's lifetime the introduction of GDPR, medical device regulations, and then emerging standards in security, in evidence, as well as changing, a hugely changing technological landscape in terms of things like AI. And of course, all of that in the backdrop of trying to balance regulation and innovation and not over-regulating an innovative and vibrant market. So what ORCA, set out to do is to try to deal with that key issue. And we built an assessment process with those key problems in mind. And we knew that what we had to do right from the off was to avoid going down a route which was the historic way of doing things of expert assessment, because that just would not be able to keep pace with the scale and volume and change, and also that whole breadth issue in terms of the number of areas you need to look at. So we created 3 layers of assessment, the rapid assessment, the baseline review, and the enhanced review layers. And the rapid assessment, as the name suggests, is a quick analysis of a product to understand its key functions and features, and a little bit around its headline compliance. The baseline review, which we'll come back to in a second, is a much more detailed, it's a baseline, it's a very detailed assessment, looks at over 350 different elements of product compliance. And the enhanced review builds on those, that baseline assessment. Baseline assessment focuses on 4 key, what we call assessment domains: privacy and data and privacy, clinical assurance, usability, accessibility / user experience, and security and technical stability. An enhanced review builds on those assessment domains, but adds another one, which is finance and commercial analysis. All of that information, all of those assessments are built and underpinned by what we call the review domain master, and that's made up of 600 plus questions now. And they're essentially every question that you could possibly think about asking about a digital health product. And that domain master has been mapped to all the major assessment frameworks and schemes out there, as well as all of the major regulations. So the ORCA baseline review, which is kind of the foundational piece, is now increasingly used to underpin quite a number of those national and pan-national schemes. And it's probably the most extensively used review process anywhere, with 14,000 assessments undertaken through that process, over 6,000 products assessed. And then one of the unique things about the ORCA baseline review is that every product that goes through it is automatically reassessed every time it updates. So although you can see there's 14,000 assessments been undertaken, a lot of those are reassessments of the existing products. It's entirely free to go through an ORCA baseline review, and we think that's really important because it's a sort of entry-level assessment, and so therefore it's key that that doesn't become a barrier to people getting into the system, so to speak. We publish all of the specifications in some detail. We don't believe in kind of owning assessment methodologies in that sense. And as I say, it's underpinning many of the emerging national accreditation schemes. The enhanced review builds upon that baseline review, but it augments some of the areas of inquiry in those original 4 domains, and also, as I say, adds commercial and financial elements. It's usually only undertaken on request, generally either by a product owner or by a client in a healthcare system or a regulator who wants to have that product assessed. One of the things about the enhanced reviews, it typically will require product owner engagement. So, and most of the information provided through an enhanced review will be commercially sensitive and confidential to that product owner, but they will usually consent to its release, for example, in support of an emerging scheme or a certification. On the face of it, a number of these emerging schemes can seem to be quite different, but actually when you drill into them, there's a huge degree of commonality. So I've illustrated here everything from the NHS DTAC in the UK, the European, the new ISO standard 8304 emerging across Europe and more broadly, the emerging US digital health assessment, Canada, Germany, etc. And you can see here that actually the ORCA baseline review is represented in all of those. Now, some use that formally and some of that is informal, in as much as the information we collect through the baseline review can actually fill a large proportion of those underpinning assessments. And then you'll see the layers above that, which represent the enhanced reviews, are the areas that each of those assessments have chosen as being critical to their own needs. And you'll see that, again, there's quite a lot of commonality, but not complete uniformity at that next layer. And the way our system works is to allow those layers to coexist and to share data across those different assessment schemes where that data exists. And that reduces the burden for obviously those who are managing those schemes, but also crucially for the product owners who are going through those assessments. One of the key things we talk about is that assessment is a system. It's not just an assessment model. And in a system sense, you need more than just the actual assessment scheme, if you like, the criteria and the thresholds. You also need to think about what the delivery process is. How are these things actually going to be delivered? And what are the outputs? How is it going to be disseminated? Because it's a means to an end. And also, how's that assessment going to be kept alive with constant surveillance and reassessment? ORCA have a solution to all of this, and we don't have time to go through that in detail, but critical to the way in which we make all of that work is technology, because technology allows us to use and manage all of those significant, over 600 different questions in a really efficient and effective way. And that can either be done by ORCA's own team of 45 highly trained digital health assessors, but also increasingly client assessors do a lot of that work. So say, for example, in Holland, it's client assessors who are doing most of the enhanced review, and similarly in New Zealand. So of course, it's a means to an end assessment, and in the end, what it's all about is activation. And so ORCA also support the connected side of that side of the equation and provide lots of solutions to healthcare systems to actually start to embed the results of those assessments into formularies and then into prescribing solutions, etc. And joining all of that up with a governance process that will make this whole system feel safe and secure. So that was it, a bit of a whistle-stop tour through the world of assessment, but I'm happy to take any questions at this stage.
Tim, thanks very much. A sort of quick question. You started to explain the different types of standards that exist. Do you see that the right harmonization, if you like, is that they should all be identical, there should be one standard? Or is this about having a certain degree of commonality and then, if you like, layering on top of that individual requirements in regions or countries? I mean, can you just give us a feeling for what's happening in the market?
Yeah, I mean, I think that what we're seeing is a huge degree of convergence. So I would say that across all of those emerging schemes, and ORCA supports about 12 out of the 16 major schemes currently in the world. Across all of those schemes, 70 to 80% of them are very consistent. And I think we sort of take a pragmatic approach to convergence and say, well, actually, what we've seen is that the remaining elements, the 20 to 30% that are different, are usually driven by local regulation, or they're driven by cultural considerations. So, for example, in New Zealand, a huge amount of the focus was driven by the treaty obligations and the like in New Zealand with the indigenous populations. So I think there's inevitably always going to need to be a local flexibility. But actually, as long as that core, those core compliance areas are as consistent as possible, and we found that actually there's not very much resistance to that in those core areas like data, evidence, etc.
But actually, I'm really grateful to you, and I'm conscious that we're running out of time now. I'm really grateful to you because your work and this whole question about assessment and evaluation is really critical to trust. And without this trust and trustworthiness, the ability of digital health to be deployed at scale across borders is going to be frustrated. So you're doing excellent work, and thank you very much indeed for giving us this very interesting talk. So thank you, Tim. And we now move to a break. So if you could come back at 11:45, so 10 minutes from now, I will be very grateful. And thank you, and see you soon.